Menses is often a dreadful time for us ladies. However, some of us tend to get a lot more severe period problems. Why do some women experience unbearable pain during their periods?
Let's check in with Dr. Kanika.
Hello, I'm Dr. Kanika. I work as a gynecologist in the Astra Women's Specialist Center at Payoh.
Dr. Kanika, could you share a bit about what causes menstrual problems?
Yeah, sure. So there are few issues which can happen for menstruation. So the first thing is the pain. So a lot of women feel a lot of pain during their menstruation. Basically there are two varieties and we call it dysmenorrhea. The first is called primary dysmenorrhea, which happens usually in teenagers and unmarried women. It usually lasts the first day or maybe 1 or 2 days before the menstruation appears, and most of the time they are well controlled with just a Panadol. You don't really need to take any strong medications, and usually after a childbirth it disappears on its own. The second variety is called secondary dysmenorrhea, which is a little bit more serious, and it usually happens in women over the age of 30, and the pain is actually starts usually on day 2 or day 3 and would last throughout the menses. And this condition is usually very commonly seen in something called endometriosis.
So Dr. Kanika, what causes heavy menses?
One of the commonest is a fibroid uterus. So a lot of times we have seen that women develop fibroids, usually above the age of 30, and that can cause a lot of heavy bleeding. The second commonest cause we call as dysfunctional uterine bleeding. It is just that we don't find any reason for the heavy bleeding, but the lady continues to complain of heavy flow, and that really needs to be treated, because if the heavy flow is not treated, your hemoglobin, which is normally supposed to be 12 to 14, can drop to something like 7 or 8, and a lot of these women actually will even need blood transfusion. Third most common condition is called adenomyosis. In this, what basically happens, the uterus wall becomes a bit thick and globular. The lady experiences a lot of pain and heavy bleeding during menses. This also is a symptom which appears usually over the age of 35, and it is more common in those who don't have children.
What about spotting in between periods? What causes them?
Spotting, it can be premenstrual or postmenstrual. There are certain situations when the spotting is actually considered normal. This is usually called a mid-cycle bleed. A lot of women will get a little bit of spotting probably on 10 days to 2 weeks after the menstruation, and this is really called ovulation bleed. There's nothing to be worried about that. The most common reason for the spotting in between cycles is also because of hormone imbalance, and it's called most of the time polycystic ovarian syndrome. This usually indicates that probably the lady is not ovulating in the cycle.
Thank you for your time, Dr. Kanika.
Yeah, thank you.
Now that you know the causes of menstrual problems, stay tuned for our next video as Dr. Kanika will share on when to see a gynae for menstrual.